Hey, if you work in MS practice, you already know that optic neuritis is a typical and a frequent clinical presentation in MS. However, a less recognized feature of optic neuritis, inflammatory optic neuritis, called an optic perineuritis, which essentially does not happen in MS. And if it happens, it is a red flag to your diagnosis of MS here. So you just to remind you to in order to diagnose an optic neuritis related to MS, it is actually a layered diagnosis. So you need to diagnose it. It is actually an optic nerve involvement, and it is an inflammatory, likely demyelinating, and then it is most likely to be MS as a best explanation. Uh, Overdiagnosing optic neuritis is quite high, according to one of the studies, and mostly it is related to improper history or a faulty differential diagnosis. And just to remind you, there is a recent diagnostic criteria made to confirm the optic neuritis diagnosis using typical clinical criteria and supported by paraclinical criteria. So you would diagnose that your patient is not having a typical optic neuritis and having a rather optic perineuritis involvement to his visual impairment when he is older age, usually in the 40s, 50s, and a subacute onset that spreads over weeks rather than few days. Also, when sparing the central vision, so the patient can keep a good visual acuity, but the periphery of the of the vision starts to be involved more, and usually there might be a disc edema and recurrence on steroid happening. So your patient initially may respond to steroid, but once you stop your pulse steroids, you usually these patients tend to relapse. And there is a subtle other local orbital findings, such as subtle cranial nerves involvement, subtle muscle involvement, can also be found in if your patient having an optic perineuritis. So there is a long list of conditions that can cause optic perineuritis, and all of them essentially not MS. Optic perineuritis essentially does not happen in MS, but can happen in other demyelinating conditions such as MOG antibody disease, neuromyelitis optica, spectrum disorders, the full list of autoimmune conditions, and also the different vasculitides that may affect the optic nerve supply. So what to see in an MRI for a patient with an optic perineuritis? Essentially, you need a dedicated MRI orbit on a high field scanner and use a contrast enhancement. You would expect few signs that we're going to see together now. Um, so here is essentially what makes a difference between an optic neuritis and an optic perineuritis. On the left hand side, you can see that it is an inflammation to the left optic nerve here. So it is inflamed, swollen compared to the fellow healthy right optic nerve, and the surrounding of the nerve is intact compared to the image on the right hand side. So you can see there is a particular enhancement to the periphery of the nerve. It is the sheath, and there are fatty streaks surrounding it. So there are some contrast enhancement to the local orbital tissue surrounding the optic nerve. This is a red flag against MS. And this one sign for this patient is the donut sign. So as you can see, a surrounding enhancement that looks like a donut. And here is another example to a patient with optic neuritis due to MOG antibody disease. Here is a good example, another example here, and you might feel a bit of streaks on both sides. This is a triumph sign, and in one study, it showed that it happens almost in 1/3 of patients presenting with MOG positive optic neuritis. Also, it can happen with neuromyelitis optica spectrum disorder, and here is another sign where you would anticipate the tram sign in a patient with neuromyelitis optica. And here is another optic neuritis happening in a patient with COVID infection, and another patient with spondyloarthritis, seronegative spondyloarthritis. Also, here is another example of the tram sign here. So the bottom line is that you need to be aware of this differential or this clinical entity that might accompany a patient with a diminution of vision, and the need that if you see this sign, it is likely not multiple sclerosis, and you need to exercise the other possibilities as the other inflammatory possibilities in MS. Thank you.